We grew beyond prostate. We got one of the best kidney cancer surgeon, that is Ketan himself. We got one of the best bladder cancer program led by Peter Wicklund. We started talking about urologic oncology and mixing it with the robotics, mixing it with the surgical techniques, because ultimately the cure happens because of certain techniques, certain medications, but the science makes all the difference.
So I did a live surgery this morning, and it was a little bit unique because we have an alternative way of doing robotic kidney surgery now using single port, and doing it from a little incision down in the abdomen. And so to show the audience from incision to actually doing the procedure is a unique thing. Because of the way we do it, it's very important to know we can do all this through a little incision out of the way where you can hide it and you don't feel it. So I think it was a unique experience for the audience because they got to see it from incision all the way to the end.
Yesterday we had a full day of live and semi-live surgeries. As a trainee, I loved being able to hear experts from all over the world talk about all different kinds of surgeries.
Innovation is what I strive for, and I think this conference is an amazing platform. I have never assisted to a surgery, and after 20 years of research in prostate cancer, I had yesterday the opportunity to see a prostatectomy live. So this was amazing.
What brings people here is really the stellar group that are presenting, that are working in the frontier of the knowledge.
People said, well, you won the Nobel Prize, what are you going to do next? And there was no next. I haven't reached my goal yet. It's been an amazing conference with such a broad range of interests and activities. We're all driving toward the same point, which is trying to improve the life of cancer patients and to detect cancer earlier, treat it earlier, and hopefully have a better outcome for patients.
It's an incredible privilege to be part of the Mount Sinai Prostate Cancer Symposium. The new tools that we're bringing to this include new AI tools to understand which patients to treat, new AI tools to understand how to do the imaging and how to do the appropriate triaging of patients, and also new surgical tools pioneered by people like Dr. Tiwari. I'm incredibly privileged to be part of this symposium, and I hope that I can be part of this for many years to come.
We have 6 robots here, we have 12 trainees, and we have trainers come from ORC and Mount Sinai faculty.
We are here actually because we want to export our training methodology, the so-called proficiency-based progression training methodology.
In the first day we had a course in which we used chicken models to do an anastomosis. On the second day we are having a course with the cadavers in which we are doing a prostatectomy using and following the same methodology.
Yesterday we actually had the chicken lab, which was an amazing experience. It's also an invaluable part of our training. The ability to train at Mount Sinai, have this experience every single year, has really been a complete pleasure. We feel extremely grateful.
The meeting has now become a 4-day meeting, and we started with a whole day of semi-live surgery and also live surgeries.
Another unique thing we've done for this year's symposium is we've introduced a semi-live component. What we did is we had 3 different channels running with videos that were pre-recorded but narrated live. And so the audience could pick which screen they wanted to watch, which surgery they were interested in, and in a half a day's time we could watch over 20 different surgeries and 20 different procedures, which I think was a really big hit this year.
To see the simultaneous surgeries take place and featuring bladder and featuring kidney and featuring prostate, and to get that ability to switch back and forth between, to hear the commentary by the surgeons themselves, it was really exciting.
You wanted to have a flavor of a European way of doing this. The best way to combine the two cultures was to use the semi-live. It was very interesting to see the impact that this has given to the American colleagues.
It's luminaries of the surgical world. So this is an excellent opportunity for even people who are in the OR or outside to be able to appreciate and hear tips, tricks, and techniques.
Well, I've had a great couple of days here in New York. The conference itself has been a fantastic mix of speakers from different backgrounds. The faculty here is strikingly international and really on top of their game. It's been a really, really interesting visit.
We're offering free PSA testing at the conference, which is a critical step in making early detection accessible to a broader audience.
It's a great meeting because it allows to kind of combine the surgical part of urologic oncology with the more theoretical and underlying strategy which you need to treat a urologic oncology case, be it prostate cancer, bladder cancer, renal cell cancer.
At the end of the day, we want to cure patients, and this type of conferences bring the best together for the benefit of the patients.
I hope we can do it every year from now on, and let's see what the future says.
It builds this excitement, not just for this year, oh my, what are they going to come up with for next year? And I feel so honored to be part of this, symposium, this session, and this department.
We're going to continue to innovate, we're going to continue to make this symposium bigger and better, and we'll see you next year.